Hello and welcome to the next session of the Epitrax training. Today we're going to finish up our training by talking about forms, event filters, tasks, people, and the various searches that you can do in this system. So I'm going to go ahead and share my screen. So here we are inside of an Epitrax record. Last time we spoke, we talked a little bit about forms and a little bit about what they look like inside of a record. But I wanted to go over that a little in more detail today. So first of all, forms are created by system administrators, and they're created to fall in line with the CDC message mapping guides or local and state requirements. If you find that there are fields that you require for your investigations, but they're not inside Epitrax, you can contact one of the system administrators and they will gladly create some form fields for you so that you can collect the data that you're looking for. You'll see here, if we hover over our little eye icons here, it will tell you that these are help icons. If I click on it, then you'll see in this case, it displays help instructions for the field entitled transgender information. And the help instruction states patient's transgender identity. So that's one example of one of these instructional icons. Same with additional gender here. If we come to the investigation tab, this is really where we're going to manage a lot of that form data. You'll see here that the form that displays is the Hepatitis C 2018 update version 1. We come down a little bit, you'll see that there are some follow-up fields. So if I click yes here, you'll see there's an additional field that pops up. The same with this one and the same here. You can also see that there are these little red X's. If I click on them, they clear the selected values. Then if I come over here to the associated forms, you'll see that there are two different forms that have automatically been attached to this form, to this event when it was created. The base form, Nevada, and then the Hepatitis C 2018 update, which is the one that displays here. You do have the ability to toggle back and forth between forms. So there can be multiple forms, as we show here, that are associated with an event record, and multiple forms that might display information here on the investigation tab. So right now we're looking at the Hepatitis C 2018 form as previously indicated. If I come here to my base form Nevada, I can click on this little arrow button and it will show that form here if there's any information to display on the investigation tab. If not, it will let you know. So I will go ahead and click back here. We also come here to manage forms. So I can come here on my manage button, click. You'll see that this first form here is associated with many different diseases, so it's pretty long. We can open this up just a little bit. Then we can pull this up. So you'll see that this first form here is the base form Nevada. We're just gonna make it a little thinner here so we can pull it up a little bit more. Oh, we'll just try that again. We'll click on manage and we'll yank this form up. We'll just pull it down here. And we get down to the bottom here and you'll see the second form, the Hepatitis C 2018 form. I'm going to go ahead and delete that form. So you'll see we can remove forms that are already associated with the record. If I come back here to manage and we'll pull that up again, and I come down here to my forms, I can add that hepatitis C form back. So in the case that there may be a form that's associated with a record, but it's set to manually add and not automatically add to the system. So possibly in the case if there is a pregnancy-related form for hepatitis or for COVID or whatever the case may be, then you can come here. If there's a female and she's pregnant, you can come here, you can manually upload that pregnancy form, and that's how you would do that. That's just one example. If I come down a little bit further here, you'll see that there are special kind of form fields that are called repeating sections. So if I come here, I could add an industry, I could add an occupation, whatever that might be. If I decide that there's more than one occupation for this individual, I can come here to add a row. And I could add additional industry and occupation. If I decide that no, there was really only one, I can delete one of those. So there's lots of functionality there with the forms. And this is really a good bonus to Epitrax, is the ability to really customize condition events in this system. So that is forms. The next thing I'd like to talk about is the event. So you can access events either by coming up here to navigate in events or clicking up here in the green banner. So we'll just go ahead and open up another tab here for our events. You have the capability of setting up multiple event filters in the system or different views so that you can see different listings of your cases. So we'll go through 3 different examples of views that you can set up. The first one being new COVID-19 records. So we'll just say new COVID. I'm going to come down here to my event investigation status, and I'm going to say, click on assign to local health department. This indicates to me that it has been assigned, but it has not yet been accepted or assigned to an investigator, nor is it under investigation. So I come here and click on assign to local health department. I can either X out of this box or I can click outside of the box. Then I'm going to come down here to diseases. We are going to look for COVID. Okay, there's our COVID. I am going to check my investigating agency. In this case, I'm signed in as a Carson City Health and Human Services investigator. I could have multiple agencies for which I'm responsible. If that's the case, I could come here and click on one or all of those. Okay, so now I have my view set up to have my new cases for COVID-19 for my agency. Then I come back up here to the left and click on save. You'll see that I have currently 1 new case for Carson. If I want to go ahead and accept the case here, I could do that over here under flow, and I can accept it. If there were multiple records, I could come here and click on all of them, or I could just check the ones that I'm interested in. And then I could come up here to my bulk workflow. I could choose the route or the accept event and then apply workflow. But because I only have 1, I'll just come here to flow, accept event. My workflow action box pops up. I click on accept event, and then you'll see it disappears because that's the only one there. Under more options here on the top right-hand side, I can make a change. So if I just wanted to see those that are confirmed, then I can come back here under more options and update current view. I can also delete my current view. So if I create this and then I think, no, I don't want that, I can delete it. If I want to add an additional view, I can come here to add view. That's what we're going to do. We're going to add our second view. So this time we're going to do COVID investigations. And this is going to show me all of the current COVID-19 records in my jurisdiction that are under investigation or have been accepted by an investigator. So I'll come down here to event investigation status. And I'm going to check assigned to investigator. And I'm going to check under investigation. And then under diseases, once again, I will search for COVID. Okay, click on COVID. Under investigating agency, once again, I'll click on my agency. And then those are all the different filters for this view. So I'll go ahead and click on save. You'll see now it is listing all of the investigations for my agency, independent of investigator. At this point in time, if I'm going on vacation or possibly I'm ill and there's an extended period of time where someone else needs to pick up my investigations, or I need to reassign them, or someone else needs to reassign them, you can come here and click on these last few. And then I can come up here to my bulk workflow, assign to investigator, apply workflow. Then on workflow actions, I can select an investigator. So we'll just select our investigator here, click on the name, assign to investigator. You'll see that the system will tell you right away in 2 different places, successful. Bulk workflow assigned to investigator was applied to 5 events. You can see it here as well. And if I come down here, you'll see that now all of the events have been assigned to Catrice Hale as the investigator. If I want to create event views that are specific to investigators, I can come back here to add view. I can come here and say I want Catrice investigations. I can make a different view for each of my investigators. My event investigation status is going to be assigned to investigator or under investigation. I would come here and I could search for my investigator's name, click, my disease. If I wanted to specify by disease, I could. If I just want all investigations, I can leave it at that. So we'll just go ahead and leave it there for now. And you'll see now I can see all of Catrice's investigations, regardless of disease. If I just wanted to see COVID, I can come back here to disease, type in COVID, click on the disease. Under more options, I can update current view. And you'll see here now I can see all of her COVID investigations. The first view that you create in the system will be your default view. You can see your various views by coming here and clicking on the down arrow. You'll see new COVID is my default. If at any point in time I decide I want a different view as my default, I can come down here. I can click on COVID investigations, for instance, click on more options, and then I can set a different view as my default view. Earlier, we looked here on flow, and we saw that we can change our workflow of individual records here. Under options, I have the option of editing or viewing the event, or some print options, editing or viewing the person. For my print options, I can click here. And then you'll see I can print either by the tab inside of the event or individual sections inside of those tabs. And then this will print to a PDF. We talked a little bit about brief notes in our earlier sessions. You can see here that brief notes are displayed here. So if there are any notes that I want to take a look at, I can see them. I can change the brief notes from here as well and save them. So there's lots of functionality here inside of the event. I'd like to also note that anyone at your jurisdiction with access to a condition can see all of the cases for your jurisdiction inside of that condition. So those are conditions inside of the event. Now I'd like to talk a little bit about tasks. We, in our previous session, mentioned that we would talk about them today, so we'll go ahead and do that. If we click here on settings, remember this is the first place we came when we first logged into the system. We went under the general tab and we talked about updating all of our information here before we get started, and we talked about the importance of that name, first name, last name, phone number, and email inside of the event record. So under this investigator, if your name is not entered in the settings, you will not be displayed as a choice for investigator. And then if your email address or telephone number are not entered, when we come here, assign you as the investigator, click on the investigator, you'll see that that won't be displayed. So it's important to enter that information into settings. Also here in settings, we have our task user tab and our task agency tab. We'll talk about both of those. So we'll start here at task user. There are some tasks that are automatically generated by the system, and you have the ability to come here and to specify how you would like to receive those tasks. So whether it is an Epitrax task that displays on your dashboard, and we'll go and look at that, or whether it will come in the form of an email alert. So if I come here and I decide, hey, I really want to see anytime a new clinical or brief note are added to a record for which I'm an investigator, I can come over here to the far right, click on my little action pencil. If I want to have a dashboard alert, I can click here. If I want an email alert, I click here. And then when I'm done making my selections, I can come right here and click on my little checkbox. And you'll see that now my settings are saved successfully. If I am the administrator or a manager at an agency, I can come to this task agency tab, click on that, and I would have the ability to fill out the same task choices, but it would be for my entire agency. So that would override anything that other users in my jurisdiction had set here. So that's a really important difference between those two tabs. You'll see that each of these different tasks are separated out by disease or disease group in the system. These were created by the system administrators to really kind of fall in line with those message mapping guides. So that's how you would manage the tasks in the system that are created by the system. If we want to talk about tasks that can be created by individual users, we'll come back here to our record. You'll see that there's a tasks tab. We'll go ahead and click on our tasks tab. In order to create a task for a record, we'll come here to the far right and click on Add Task. You'll see that there are various categories for tasks, so things like appointment, callback, treatment, data requests, attachments, etc. So I can click on a category. I can enter a title. I can set a priority, so whether that's low, medium, or high. I can establish a due date, so I'll just say today. We can make it repeating, so whether that's daily, weekly, monthly, or yearly. And then we can tell it when to stop repeating. So we'll just say the 13th. We can assign the tasks, so either to ourselves or other users. So I'll just go ahead and assign to me. Then we're going to go ahead and save our task. Once that task is saved, you'll see that it was a repeating task, so it's going to display here multiple times. I have the ability to change any of the different fields inside of my task, including setting the status. So if it's pending, I can change it to complete. If you click here on task schedule and then grab it and move it up, you can see that my tasks are displayed in a calendar format with complete being in green, pending in blue. I can change it from a month view to a week or even a day if I so wish. I can filter, so if I only want to see pending tasks, I can do that. So that's the functionality inside of the tasks, inside of an event. So we'll go ahead and click that. And then I'm going to go ahead and save and exit because that's what I want to do every time I'm done with the record, so I can unlock it for other users. And then I will come here to the far left-hand corner and click on Epitrax. When I do that, it will bring me back to my dashboard. So this is the original screen when you first log in, and you'll see that there are lots of tasks listed here. So this will show me all of the tasks that have been assigned to any investigator inside my jurisdiction. If I want to customize this view, I can come here to the far right, click on View Options. I can either filter by dates, by disease, by investigator, status, category, or priority. So I'm going to go ahead and just filter by my tasks. So I'll come here to Assigned To. And I'm going to click on the checkbox by my name. Then if I click Update, that will change my view as of now. Then if I click on Set Default, this will be the default view every time I log into the system. If I come back here to View Updates, that's going to collapse that. And then you can see here are my various tasks for me as a user in this system. You'll see because I have a lot of different repeating tasks, they're going to display multiple times for different due dates, and some of them overlap, as you can see. From here, I can come to the far right on this Edit column. I can click on my little Edit Tasks pencil. I can change the title or description or category or priority. I can change to whom it's assigned. I can change my status here to complete and click on my little check mark there. And then because I set my filter to only display pending status, next time I come in, I will not be able to see any that are marked complete here on my dashboard. I can come here and click on my task schedule tab. And then you'll see it will display my various tasks for me here. Just like inside of the event, I can come here and I can change from month to week to day. Okay. I have various filters up here, up top, so I can filter different views. If I click on one of my tasks, it will bring up a little event details box, and it will display the title and the status and due date, descriptions, assigned to a record number that's hyperlinked. So if I click on this, it will lead me into the event type, and then also the disease. So a few different ways now that we've looked at being able to help manage records inside of the system, and to be able to keep track of and to not lose any of them. Now we're going to go ahead and talk about the different ways to search in this system. So in our first session, we talked about new CMR. Just going to go ahead there and review. So here in new CMR, we can enter in our last name, our first name. We talked about how this is searching off of people in the system. If I come down here and decide that this is my person, then come down here to events, it's going to display my various events for this individual. I can also see demographic information or laboratory information. Now we'll go ahead and compare this to the people search. The people search is almost exactly the same. You'll see here, it's the same search format. It displays in the same way with the people. I click on it and the events are nested underneath there. Then the final way to search in the system is the CMR search. So I'll go ahead and open a tab here. Search on the same criterion. This time, if I search, it's not searching off of the actual person record in the system. It's searching off of the events for that person. And you can see that they're listed in a different format. You can also see that if I have the ability to see a condition in the system, it will list all of the records associated with that condition for my search criteria. So you see here that I can see things for ELCO or DHHS. It is important to note that if I click here on the record number for an event that is outside of my jurisdiction, I will not be able to access that event. A screen will pop up telling me I do not have access to that event. You can only have access to records inside of your jurisdiction for conditions for which you've been assigned. Also here inside of the CMR search is the advanced search. If I click on that, it's going to bring up additional search filters. So things like conditions, city, county, lab accession numbers, investigation statuses, case statuses. So lots of different filters to use, which can be pretty handy at times. So those are the 3 different searches in the system. Throughout the course of our different trainings together, we've talked about settings. We talked about new CMR and that search. We've talked about how to create a new event in the system, whether it's a morbidity event or a contact event. We went through the different tabs inside of the events, the workflows on how to assign or reassign investigations. We talked about the differences between a person event or a morbidity or contact event. And then during this session, we talked about forms and how to manage those forms. We talked about events and creating different event views. We talked about tasks, how to manage tasks, how to create and assign tasks. And then we talked about the various searches in the system. I would like to reiterate here at the end of this training, please take the time to get into the system, to take advantage of the training environment that you have, and to really just train and to test and to Play around in there as much as you possibly can. I think that the more you get in the system, the more familiar you become with the system, and the more comfortable you become with this system. And thank you very much for your time today. We'll talk to you soon.